Hi, my name is Stacy, and I'm doing my performance check number 2. I have my patient here, Kara. How are you?
Good, how are you?
Good. I am going to wash my hands here with some sanitizer. It's always good to carry some around in your pocket when, if you're not around a sink. Hand washing is the best. I'm Stacy. I'm going to be your nurse practitioner today. Nice to meet you.
Nice to meet you.
Anything you feel that's wrong with you? Any trouble breathing?
No, I feel pretty good.
Okay, good. So while I'm just talking to her, chatting, I'm visibly looking at her. She is breathing normally. There's no tripoding. She's not leaning forward. There's no use of the accessory muscles. There's no effort to her breathing. Her skin looks good. It's nice and warm. It's nice and dry. There's no moisture. There's no exertion of her skin. Her muscle development seems fine and intact, and everything looks symmetrical as well. So we'll start off doing the lymph nodes, and I'm going to start on the back of her head. So I'm just going to put my hands on you, and I'm just going to roll with my 3 fingers, okay? Just tell me if you feel any pain, tenderness, anything like that. So I'll do the occipital, the postauricular, the preauricular, the submandibular, submental, the tonsillar, postclavicular, anterior clavicular, and the deep clavicular. We'll move on to the supraclavicular, and the inferior clavicular, and we'll move over to the epitrochlear. So, any of that hurt?
No.
Anything?
No.
Okay, good. So there was no swelling, there's no tenderness, no pain. Each lymph node on each side was symmetrical, and there was no changes, there's no lumps, no nothing I could feel under the skin that would make me worry. So her lymph nodes look good. So next we will do her back. So I'm just going to have you turn around to swing your legs on the other side. Okay, great. And while we're doing an exam, this can be kind of embarrassing, so you want to always protect their privacy. And so I'm just going to give you this blanket to put over you, and you can keep it up as much as you need. And if you feel uncomfortable at any time, just raise your hand, and I'll walk you through everything too. So while I'm getting her comfortable, getting her settled, I'm just going to be looking at her back. It looks symmetrical. You can see the spine right down the middle, and the scapulas are equal on both sides. There's no trauma, there's no bruising, there's no overly sweating or exertion. You can't see any accessory muscles working. The muscle development looks good, and they're equal on both sides, which is very important. So I'm also going to check her rate of breathing, and it's equal on both sides. Her pattern is regular, and it's not with any effort, which is good. So from inspection, I'll go to palpation. And so I'm just going to palpate down your spine, and just tell me if anything hurts here. And again, I want to compare each side as I go down. And any of that hurt?
No.
Tenderness. Okay, good. And it was straight right down the middle. There's no excessive curvature or any masses or lumps that I would be worried about. I'll check the scapulas. And again, you want to go side to side and compare each side. Both scapulas, they're flat, they're not winged, and they're equal. They're also equal in size and their position. So next I'm going to check her breathing. So I'm going to put my hands on her chest like this. I'm going to have you take a deep breath. And out. Good. So both my hands were equal, rise and fall, and on both sides. So it showed that both lungs were expanding and equally. So next we'll go to tactile firmness. So whenever I place my hands on your skin, just say the word 99 for me. And I'm just going to be feeling for the vibration, see if I can feel that through my hands.
99, 99, 99, 99, 99.
Good. So they were equal on both sides. Again, I wanted to use both sides. I could feel the vibration with my hands, and I was able to feel the vibration, which is a sign of good movement of air through the lungs. And from there, we will do the percussion. So I'm going to start at the top lobe, and I'm going to compare side to side. I'll use the middle finger of one tapping with the middle finger of the other. I'm just going to lift up this right here, and I'll continue down here. Good. So her percussion was normal. It was equal on both sides. There was no increase in dullness, which would indicate a mass or a lesion, and there was no increase in tympany, which would indicate a pneumothorax. So I'm also going to percuss the costovertebral angle, which is right here, and this is where the kidney lies. We made an imaginary triangle right there. Good. So the kidneys seem intact, there's no pain, and that seems good. So from there, I'll go and do the auscultation. So again, I'm going to start at the upper lobes and go each side. And when you feel my stethoscope on you, just go ahead and take a deep breath. And now, when I put my stethoscope on your skin, can you please say the word E for me and draw it out like an E? Okay?
E.
Good. So with the auscultation, I did both sides. I was careful to avoid the scapulas so that I was able to actually hear the lungs at the best level as I could. I also had her say the word E to use egophony to make sure that her E's sound like E's and don't actually sound like an A. Her lung sounds sounded clear. There was no, didn't sound like any fluid or any diminished. They were both equal on both sides. The things you don't want to hear are crackles or rails, which are kind of like hair crackling in your ear. Also, an abnormal can be bronchi, and that is more like a coarse, rough sound. And you also don't want to hear wheezing, which is like a whistling sound, like the wind whistling through the wind, and you don't want to hear that. That can be a sign of constriction in the airway. So from there, I'm going to have you just go ahead and whisper your favorite color to me when I put my stethoscope on your skin. Good. So I wasn't able to see her lips move because she's turned the other way, but I did hear the color blue in my stethoscope. So the whispered periphery was positive coming through the lungs. So the back looks good, and if there's no further pain or tenderness or any other concerns that the patient has, I'm going to have her lie down on her back in the recumbent position. And again, you can use this to cover up as much as you'd like. We want to protect privacy as well. Okay. And again, I'm going to start all over with the inspection. So I'm just inspecting the front of hers. I don't see any bruising, any lesions, any trauma. I don't see any acne or any skin problems that would worry me, like colorful moles or anything like that. Also, her muscle tone is equal on both sides, which is good. She was able to lie down on her own with good strength, and good posture. She's able to keep herself straight. There's no barrel chest. There's no over curvature of the spine that's making her go up or down. So her posture is good. Also, her respiratory is normal. She's breathing at a nice, normal, steady pace. I can count while she's here. While we're just talking, it's about 16 breaths per minute. And no exertion, no signs of exertion or shortness of breath. So, and no overly effort. There's no use of the accessory muscles retracting in. So the inspection looks good. We'll go on to palpation. So I'm just going to palpate the skin. I'm just going to be looking for the stability of the bones. And as well, I'm going to be looking for any crepitus or tenderness or pain. Is there any pain there?
No.
And again, I'm comparing each side to make sure both sides are the same. Any pain there?
Mm-hmm.
Go ahead, breathe for me. Good. So both hands went up and down equally. There's no tenderness. There's no pain, and there's no lesions or lumps or masses that I can feel under the skin that I would be worried about. I'm going to check the tactile firmness again, and so I'm just going to have you say the word 99. I'm going to put my stethoscope on.
99. 99. 99. 99.
Good. So again, that was positive. I was able to hear the vibration through her thing. I can also use the palm of my hands to do that. So go ahead and say 99 again.
99. 99. 99.
Good. So I can feel the vibration through the skin, which is a positive sign of tactile firmness. From there, we'll do the percussion. Again, we want to go side to side and comparing and making sure that there's no orally dullness sounds or tympanic. So again, I'll use the middle fingers. Good. I also want to make sure to go over the apex. And the liver. And everything sounds good. There's no increase in dullness or tympany. They're equal on both sides, which shows a normal level of breathing. I'm going to auscultate. And again, when I touch my stethoscope to you, just go ahead and take in a deep breath. Good. So again, I was going side to side, trying to compare each side. Both of them were equal. They were normal. I didn't hear any adventitious signs, like the crackles or the wheezes or the rhonchi or rales to make me worrisome. She seems like a very healthy 30-year-old woman, and since there's no further problems, I would encourage her to exercise and eat healthily and to come back to the doctors if there is any signs of shortness of breath or anything wrong with her breathing. Thank you very much, Farah, for helping me.
Thank you.